Hello, welcome back to another episode of Cultivatics with Dr. Adrienne. Today we will talk about digital health strategies. So I know that we've had previous episodes referring to workforce capacity and contract work and what developmental systems look like in emerging technologies, and even one or two on what strategies or scaling of health systems entailed. Thank you so much for the emails I received and the contact about questions regarding, well, what do you mean digital health strategy? In what way and what methods are you referring to, Dr. Adrienne? So I wanted to just share a few points today. What I'm referring to includes the planning and operational components that will assist in encompassing all of the, or at least the priority elements of your organization, your enterprise, your international agency, your hospital system, your medical center, even on a smaller scale too, even if you are what some will consider a mom and pop shop or a small pharmacy or something like that. What are those elements that could be digitized? Just take a minute to think about that. What are processes that could be automated to assist with the goal of quality healthcare, improved outcomes? All right? And so when you look at your mission and you're looking at how you're improving the medical system and how you're embedding in the medical system through health information exchanges or other elements of information share that could be needed, that may currently be paper-based. That's not always a bad thing, it just depends. And also the efficiencies, okay, and the accuracy of what such data looks like outside of the paper realm if you are digitizing. Have you thought about that for your organization? Say you are a pharmacy and you're now able to use a mobile app for those who aren't able to come in person to order. And I'm speaking for the LMICs, the lower and middle income countries, where some of these proficiencies are really just sprucing up or are enhancing. I'm not necessarily referring to some of the first world countries where some of this is standard, okay? And so I think it's really important for us to think about how current processes in a facility, going from the lab to radiology, going from billing to consultation, okay? How can some of those efficiencies be improved with a digital health strategy? One way is to also make sure that the strategy that you have for your in-house organization, all right, aligns with what your country or your government would like as their focus areas. And I'll tell you why. It will assist you in obtaining funding when you can say, well, my government is focused on this element. Now my organization is focused on this element, okay? Because when your government is focused on certain topics, improved information share, improved health outcomes, data and interoperability, and all these topics that we're very vastly aware of in some countries and maybe more than others, it's okay. When that funding comes in, it's important to be able to say, well, I'm aligned with that too. If that's a necessity, if you are looking for outside support to ramp up in your digitizing for your organization, that's what's important. But the strategy is to share the background of your organization, the goals and the outcomes that you're looking for in your organization. What's measurable with what you do in the communities that you serve? Who are your beneficiaries and why? What are those numbers looking like? How many lives saved? How many patients that have adhered to their medications or to their treatment plans? Okay, what does mortality and morbidity look like within certain topics that you may serve, okay, with your patient set or with the individuals who you supply support to? How can this be enhanced? That's what your digital health strategy will entail, but from the automated standpoint of how can I now do this more robustly, likely quicker, and likely more enhanced for my staff, for my in-house support systems, and for the beneficiaries. What are some of those processes that can be automated? What are the top 3 things we do every day that are routine that can aid us in making this goal? Just something to think about, okay? I hope you have a wonderful day. Continue evolving in your light, and please visit www.cultivatics.com and on social media at Cultivatics with Dr. Adrian. Thank you so much, and be well.